you for inviting me. Yes, that's correct. So I am actually not a a tech person. I'm a medical doctor. I have a PhD on clinical validation of AI in colorectal cancer research. But today I will be talking about something that at least occupies my time a lot of the time, and that is designing for diversity, a gender-inclusive approach to AI deployment. Now, in medicine, this is something that we really need to think about. We need to have that in mind, that our data is full of bias. We are biased as both professionals, doctors, healthcare professionals, generally people. Now, I work as a lead AI in healthcare at Deloitte, but this is still something that occupies my time. So today I'm going to talk about the importance of this, the designing for diversity. And I want to dive right in and give you some context. Now, women are 32% more likely to die after operation by male surgeon and have 15% more chance of a bad outcome than if the procedure was done or performed by a woman. This is according to a study involving 1.3 million patients and nearly 3,000 surgeons. This was published in JAMA Surgery in 2022. This is one of the big top-tier journals in medicine. So what does it mean? Now, this result has real-world consequences for female patients and manifests itself in more complications, more readmissions to hospital, and death for females compared with males. Now, on a macro level or societal level, these results are very troubling. And I'm sure you can understand why, because there shouldn't be any sex difference when it comes to patient outcomes, regardless of the surgeon's sex. So, is it really true? One size fits all, or one size fits all men? Now, when I was in med school, all my anatomical books, they were, let's say, the ratio between male sketches and female sketches were skewed. This is not uncommon. Before that, past 50 years and before that, it was even more common to only have the male body as the default. And the female body was regarded as kind of like the male body with many, many layers of wrong parts. So, and this is not something that, don't just take my word for it. Just look up any anatomical book from the past 50 and way beyond that, let's say 100 years. Even 20 years, I think, I've found an anatomical book that is quite full of these sketches. So, somebody who is who has done a lot of research on this is Caroline Criado Perez. She wrote this book called Invisible Women: Data Bias in a World Designed for Men. So she addresses the gender disparities, and this is discussed thoroughly in this book. Now, the book describes the adverse effects on women caused by gender bias in big data collection, and gender blindness in tech culture produces what Criado Perez calls the one-size-fits-men approach. Now, the average smartphone is 14 centimeters long, which is too big. Like this hand is not 14 centimeters. And speech recognition software is trained on recordings of male voices. Now, even safety tests in cars has been done on male bodies, and they don't account for women's measurements. Now, unless we crunch the numbers, look at the data, and take positive steps to correct the bias, Perez argues that inequality will automatically continue, and I actually agree with her. Now, let's look at the health disparities. So, gender data gaps in healthcare are already putting women at risk in many ways. So you have adverse drug reactions. 2/3 of the adverse drug reactions reported to the Norwegian Medicines Agency, they are from women. One risk is that the standard male dose may turn out to be too high for women. For instance, with the Ambien, the sleep pill. The recommendation reduced the dose to half of what was already being recommended because women metabolize at half the time as men. Care delays and errors. Now, doctors tend to misdiagnose, underdiagnose, or even undertreat diseases that predominantly affect women, or in situations where women present with even different symptoms for common diseases, for instance, with heart attacks. So when a woman comes into the ER, she may be presenting with symptoms that are very diffuse and not very typical. It's not something that you learn in the typical textbooks, medical textbooks. So maybe she will come in with symptoms that remind you more of like a headache. This makes it much more difficult to diagnose, and it takes much more time and experience to actually see through that kind of bias. Even with other diagnoses, such as endometriosis, it takes up to 10 years to get that diagnosed. And this is something that affects 5 to 10% of women, partly because many physicians either dismiss or don't believe or doubt the reports that are given by the female patients. So compared to men, women who report chronic pain, they are even described less effective pain medication. Experience of more disease and disability as well. Now, women outlive men on average, but they experience more disease and disability. So they also have a lower survival rate for certain diseases, for example, heart disease, which I mentioned previously. And this is the leading cause of death in women, as well as in men globally. Now, after a heart attack, caregivers who are typically women, they're likely to suffer another heart attack or die within a year. So let's look at the bias. Now, many of the problems that led to health disparities are rooted in gender bias. And gender bias in healthcare is so widespread. So patients, doctors, researchers, administrators can all hold biased views about gender. Now, these views affect how healthcare systems work, and they have a serious impact on health outcomes. Now, inequity in medical research reinforces those gender bias. So you have one bias is a typical male default mindset. Many reasons for the exclusion of women, and we just refer to them as male default mindset. Now, historically, male-dominated professions in science and medicine, they tend to have, like I said, the male body as the baseline. Another bias is women's health research. Now, for decades, there have been well-meaning regulations that have kept women in childbearing years out of clinical trials. So most of our research from before 1993, when that rule was reversed, is actually very flawed. That means, or has two implications. One is that we don't really know the implications on drugs and treatment on women from clinical trials. Another one is that we actually have to accept that maybe there were some medication and some treatments that would have worked solely on women, but they weren't included in those clinical trials. So there's a missed opportunity as well. And also, again, disbelief in symptoms. Now, there are stereotypes about gender that affect how doctors treat illnesses and approach their patients. Now, you could say, couldn't we just solve that problem with just hiring all female doctors? Unfortunately, no. There are biases as well. So these biases are perpetuated. Now, recently, the Norwegian Ministry of Health and Care Services launched their report on women's health in Norway and why sex and gender matter. Now, this report addresses the biases and health disparities affecting women. Now, they concluded that we have failed to account for sex and gender health policy and healthcare services. Now, there are three findings that I want to highlight. One is that women's health is considered low prestige, and this may have consequences for priority setting in healthcare. The second one is that updated knowledge on sex and gender differences in health is not sufficiently integrated in healthcare policies, and women's voices and experiences are not listened to. So even though they speak up, nobody's listening, or at least not those in power. Now, the commission behind this important report, they also gave us an action list of 75 actions to be taken and a request for an additional 1 billion Norwegian kroners to the funding of women's health research. One of the recommendations from that list was to utilize more technology in precision medicine to benefit women's health and customize the treatment to their needs and symptoms. Now, what is precision medicine? What you can say about it is it's not practicing medicine as one size fits all. So precision medicine is a healthcare pathway that employs numerous technologies to guide individually tailored diagnosis and treatment for patients. Now, The ambition is to design and optimize the pathway for diagnosis, therapeutic intervention, and prognosis by using large multidimensional biological data sets that capture individual variability in genes, function, and environment. Those three variables are very important. And guess what? Technologies such as artificial intelligence might be a game changer in actually promoting precision medicine and help us achieve health equity if it is being used in the right way. Now, let's look at how AI can be a game changer through a lifespan. Now, the deployment of AI, it really starts from the very beginning, and even before the beginning, before life itself. So you can deploy AI or apply it for embryo selection for IVF, which egg cells or sperms are the best to actually make this baby, okay? Then, if the baby gets sick, how can we do the genome interpretations? Well, you can use AI for that. Also, moving on, voice medical coach via smart speaker, such as Alexa. You have smart watches, such as the one from Apple. You can use it as chatbots for mental health, triaging when you get to the ER, which patients should be prioritized before one another. All of these applications. And of course, maybe the most important one at the current moment, that is diagnostics of pictures and CT scans. This is how we can get assistance in reading the scan slides and lesions, detection and classification of cancer, mutations. We can also use AI for prevention of blindness, for instance. We can also use it and apply it for promoting patient safety and predicting death in hospital. Now, what is the impact of AI in healthcare? Will AI make women more visible or just perpetuate bias? Now, there are three ways it can actually have a very positive impact. First one is it can give us more efficiency and productivity. Now, besides the productivity and workflow gains that can be derived from AI-assisted image analysis and clinical decision support, there is also the potential to reduce the workforce for many types of administrative jobs. Now, AI can also help reduce care gaps. So algorithms can absorb fast-changing medical knowledge, adopt new clinical guidelines, and apply or recommend them consistently without any delays. This is a hurdle at the moment. And also you can have enhanced patient communication. This is one of the things that got me into research. I realized I'm spending much more time in front of the computer than I am looking straight into the patient's eyes, right? It should be reversed. So, and why is that? Because we are maybe moving towards an American healthcare system, maybe, where you have to document everything in order to feel safe and reduce the chances of being sued for any misdiagnosis, any ill treatment. This is something that is, regardless of which country you're looking at, this is very important. The fact that doctors still, and healthcare professionals in general, have much more to do today than they had 50, 100 years ago. We have better equipment, but we still use more time on technology than we do on our patients. Then is the democratizing effect. Now, the patients are not dependent on whether they have an appointment with a more experienced doctor or somebody more junior. So, since the AI tools can help compensate for the lack of experience among different doctors, you actually get a leveling of competence. Now, AI could help address existing disparities as well with this. Algorithms capable of handling large data sets could support efforts to fill the data gaps, such as using new research to combine different types of data, genetic and epidemiological, for instance. Now, this is all tools that can help reduce the sex differences and gender differences and develop effective interventions for women. So what are the numbers? So as you can see, according to UNESCO and a very recent paper from Journal of Intermetrics, you have 22% of all female AI professionals. They're 22% of us. Then you have female AI researchers globally, approximately 27%. We would like to see that number increase. I mean, we make up 50%, so we should aim for that number. So these numbers are actually increasing. However, while women are underrepresented across most scientific fields, the AI sector is suffering from an even greater diversity crisis than other science, technology, engineering, and mathematics industries, like the STEM industries. So how can we make this go away? How to design a better world? These are some of the ways that we can address that. First of all, we need to support women in the STEM fields. So the recruitment actually starts way before they enter the workforce. They even say as early as in kindergarten, because the biases are already implemented there. Then you have the need for more research on women's health. More data from women is needed. There are big knowledge gaps on female conditions that we previously addressed. Then you also need more funding for innovation. 1/2 of the world's population is women, and they also actually account for 80% of consumer purchasing decisions in the healthcare industry. There's a very big gap that has not been utilized here. And then you also need to address the fact that we need mentors for women, especially for leadership roles. So to promote women to at least 50% of the high-growth AI and tech positions, and to help them position them for success. Now, in Norway, we have come up with this rule in the boardrooms. I think it's at least 40% women representation. So this is something that we have already started to look at. Now, there is another way. So for the well-being of our society as a whole, we need to fight to actually make women visible. It's not only a moral imperative, but meeting women's health needs and improving gender equity is an all-around smart solution. So, in the future, there is a growing potential for a technology that is now being referred to as femtech. Now, femtech was first coined in 2016 by entrepreneur Ida Tinn. It encompasses a range of technology-enabled, consumer-centric products and solutions addressing women's health needs. So this industry is set to be worth more than $1 trillion, and femtech companies could disrupt healthcare in a number of ways. Actually, this is precision medicine. It addresses women's need. So even if it's called femtech, it is basically precision medicine. Now, one of the ways it can do that is by improving diagnosis and care delivery. Now, clinical diagnostics companies are pushing the scientific frontier to address unmet medical needs in areas such as endometriosis or preterm birth. They enable women to access care in a more convenient and consumer-centric manner. Second option is to be enabling self-care. Trackers, wearables, at-home diagnostics are femtech solutions that are helping women take greater charge of their health and health-related data. And the third, addressing stigmatized areas. Now, companies are addressing what has been considered to be stigmatized topics head-on, such as menstrual health apps, sexual health, pelvic care, menopause. These are not sexy, what can I say, diagnoses. These are things that most people don't like to talk about, especially women, but there are big money to be made, loads of money. So maybe this is the angle that we need to put forward. And with that, I conclude. Thank you for the attention.